Okay, so what is DIC? So DIC means disseminated intravascular coagulation. So disseminate means throughout the body, intravascular means within the blood cells, and coagulation means clotting or microthrombi are forming. So because of any trigger, there are many causes of DIC, you can read that. Because of this trigger, the intense inflammatory response is set in and it activates the coagulation pathway, and in the blood vessels there is a drastic increase in the coagulation system. So everywhere the microthrombi and thrombus are and clots are getting formed. So because of this, it's a consumption coagulopathy. All the factors which are required for making a clot and coagulation and microthrombi, they get consumed. So what are they? Platelets. First the platelet values goes down because all the platelets starts getting consumed, and there is a thrombocytopenia because all the platelets are involved in making platelet plugs. Now clotting factors. So your all clotting factors starts getting consumed. So your PTINR, APTT starts getting rise, and because of the consumption of the clotting factors. Fibrinogen levels. So fibrinogen also gets consumed in making the clot. So their levels goes down, but it doesn't end there. What happens? But because there are thrombus formation in the blood system, the body tries to rectify it or correct it. So it start lysing the blood clots or microthrombi at the same time. So the fibrin degradation products and the D dimer starts getting increased, which when the fibrin gets lysed, the D dimer values starts rising. So you will have thrombocytopenia, you will have raised PT, APTTs, you will have decreased fibrinogen levels, and you will have increased D dimer products. So when you can see that this patient is having DIC, is there a scoring system? Yes, there is a scoring system. Let's see. So this is the scoring system given by International Society of Thrombosis and Hemostasis. So we call it ISTH scoring system. So first point is risk assessment. Does the patient have an underlying disorder known to be associated with overt DIC? Whether the patient has a risk factor. If yes, only we should use the scoring. If not, we should not use the algorithm. We should look for other DD. So what are the scoring points? 4. We look for platelet count, fibrin degradation products or D dimer, prothrombin time, and fibrinogen concentration. Platelet count, as we know, because platelets are getting consumed, so the more severe the thrombocytopenia, the more higher is the scoring. If the fibrin degradation products, because the clots are getting lysed, fibrin degradation products or D dimer, then the more the fibrin degradation products are there, if they are high, the more the scoring system. Prothrombin time, because the coagulation factors are getting consumed, so PT will rise. So if PT is getting rise more, you will have a more scoring system. Fibrinogen concentration, because fibrinogen is getting consumed in clot formation, so the less the fibrinogen, the more the scoring. So if we combined all 4, if the cumulative score is 5 or more than that, then we call it as overt DIC, means it's a frank DIC. If it is less than 5, it is suggestive but not affirmative of DIC. The patient may progress. So important is whether the trigger is present or not. And now once the patient develops overt DIC, there is a tendency to bleed from everywhere across the body of the patient, because all the coagulation factors, all the platelets, everything is being consumed in making this unnecessary microthrombi or clot throughout the body, and also the body is lysing those clots at the same time, so the patient can bleed profusely. So now you know when the patient is having overt DIC or non-overt DIC. Always remember that you need to identify the trigger, whether it is present or not. Now do read more about it. Thank you.